So here's some terms around the idea of performing injections that we just want to basically cover very briefly and then move on to some more, I was going to say more important material. This is very important material, but these are things you might already know, except for maybe the last two here. So we'll talk about those in a moment. So drugs, the chemical used for treatment, prevention, or diagnosis of disease. The dose is the quantity to be administered. A vial is a closed glass or plastic container with a rubber stopper, and we've seen these already in class. So the saline, the sodium chloride that you were drawing up in the syringes, that those were in vials. So those were multi-use vials, and so that means multi-use means it has multiple doses, which means you're going to come into it multiple times and pull medication out of it. And we also have single-use vials as well. And those you will see a lot of as well. The interesting thing about the single-use vials is you don't really have to pay attention. I mean, you do have to pay attention to how much you're drawing up, but those are measured very, very accurately when they're manufactured. So you'll find in using single-use vials that they are very precise to the exact amount of medication you need. We're practicing drawing up a 0.5 ml right now, 0.5 ml. Most of the single-use vials for immunizations are already pre-measured to that. So in those, you'll just pull back, get the medication in the syringe, push it up till there's no more air. You'll look at the number and you'll see it'll be precisely on a 0.5 ml each time. If it's less than that, you probably squeeze some of it out of the end, or you didn't get it all out of the vial. And we'll cover how to get that last little drop or two out of a vial, by the way. That's important stuff to know. An ampule, a little bit different. These are small sealed glass containers that have a single dose of medication. So they're kind of like a single-use vial. The difference in an ampule is you actually break the glass container. So there's not always a rubber stopper that you poke through. There's a technique where you use a 4x4 or a paper towel. You wrap the ampule in it. You bend it at the place where the glass is the weakest, and they usually have that marked, and it'll break off. And from there, then you extract the medication out of the open vial. So that's a vial that's going to be wide open. There's not going to be a stopper there after you break the glass, and you'll draw the medication up using a needle into the syringe. They're a little trickier than using a regular vial with a rubber stopper. There's definitely an art to it. And I don't think we'll be working with them this semester, but out in the workplace, you will see them. And if the clinic you're working at or that you're an extern at uses ampules, you will have a chance to practice and learn that technique. Reconstitution. This is a process of adding a liquid to a powdered drug. So there are some types of injections. Varicella is one of them, where you have a little small vial, like a single-use vial, that'll have a rubber stopper and some powder in it. And you're going to add diluent, and that's our last word here, diluent. This is the liquid used to reconstitute a powdered drug. So you'll have directions usually on the vial or coming with the medication, or there'll be a protocol book that you'll look up and say, for this medication, you'll need about this much diluent. And just an FYI, it's almost always a 0.5 ml, which is why we work with that increment a lot, because most immunizations are going to be that. You will see with certain antibiotics, there'll be a full ml or sometimes 1.5 ml, even sometimes up to 2 ml. So you'll see injections up to that level, up to that amount, that quantity. And a lot of times these are medications that you reconstitute, and especially with antibiotics, but also some vaccines. So you'll use that same type of saline that we're using in the classroom, the sterile water that you draw up when you're practicing. That's typically what diluent is. Certain medications, however, will have a specific diluent that will be another vial attached to the original vial. And you'll have a seal, and you'll break the seal, you separate the vials, you pull the diluent out of one, put it in the other one that has the powder, you mix it according to directions, and then draw it up in the syringe and administer it. So I don't know how much we'll be working with those this semester. If I can work it into the routine and we have a day where you can get practice at that, I'd like to do it. Trust me, if you don't get a chance to do it in lab, you will learn it on the job if you need to know it. And it's something that I learned on the job, never had a chance to learn it beforehand. We didn't do that in the injections class that I took when I got my degree in medical assisting. Injection types, you've heard these before. Intradermals, into the skin or the dermal layer. Intramuscular, that's our classic immunization. Almost all immunizations are going to go into the deltoid muscle or the vastus lateralis in our leg. That's an intramuscular injection. And some, like varicella or the vaccine we give for shingles, are subcutaneous injections. Like Zostavax, for instance, is something that we use to immunize against shingles in our elderly population. Those will be given sub-Q. You will find it's true generally across the board that anything that relates back to the varicella zoster, in other words, chickenpox, shingles is related to that, and of course, chickenpox itself, the varicella, and there's other branches off of that type of disease state. Those are often sub-Q. Most of the immunizations, as I said earlier, though, are going to be intramuscular, and that really is about the easiest injection to give anyway. And we'll be working with them this semester. Parts of needle and syringe, we covered this in class. I'm not going to spend much time on it, although I do want you to know these. And so here's the terms and the description of everything. We already covered it, so I don't want to dwell on it right now. You can see the words and look at the diagram and put it together. But when it comes to the needle length and gauge, this is something I want to emphasize here. So I'm going to back up one slide, and I want to call attention to the word lumen, the opening of the shaft of the needle through which medication flows. Lumen and the word gauge are directly correlated. So when we talk about the needle length and gauge, now let's isolate that word gauge. We're talking about the size of the lumen. So here it says it's the needle opening or diameter of the lumen, and that is exactly how we want to describe that. So the larger the gauge, the smaller the diameter, or the smaller the lumen, and vice versa. The smaller the gauge, the larger the lumen or the diameter. So a 25 gauge needle is larger than a 27 gauge needle. I just said it the opposite way of the way it's written here. Or you could say a 27 gauge needle is smaller than a 25 gauge. So here's a good, excuse me, there's a good example in the little diagram here. 18 gauge, we use needles all the way down to 12 gauge, which are pretty large, but 18 gauge needles are also pretty hefty, as you can see here. A 12 is yet larger. The 21 gets a little bit smaller. That's kind of standard for immunizations. Although you'll see many times your needle selection will be 22 or 25 gauge, and for almost all immunizations, that's very appropriate. When we're doing IM injections, it's in the deltoid. Those are going to be 1 inch long, so that'll be the length. When we're doing them in the glute, so the gluteus maximus, those are 1.5 inch needles. If we're doing sub-Q, we often use a 5/8 inch needle. What I just referred to there was our first word here, length, how long the needle is. We use a shorter needle when we do sub-Q because we don't want to get into a muscle. And of course, the longer needle that we use when we do intramuscular injections is with the intent of getting into the muscle. So length will be determined by the route, and the routes that we're concerned with this semester are intradermal, subcutaneous, and intramuscular. So I just wanted to clarify that thing about the gauge, the higher the number, the smaller the lumen, just so you're clear on that. I know most of you already knew this when I mentioned it in lab, but I want to emphasize it. It is something that people sometimes will mix up. Parts of a syringe, well, I think we covered this once. I'm not going to run it down again. It looks like kind of the same slide we saw earlier. So once again, if you want to take special time to dwell on that, by all means do so. I do want to take some time, though, to look at the different types of syringes. So this is the type of syringe we dealt with when we were working in class, the hypodermic syringe. So it's the classic one. This is the most frequently used to administer intramuscular injections. 2, 3, and 5 ml sizes are the most frequently used. And do remember that cc, meaning cubic centimeter, and ml, meaning milliliter, are the exact same thing. Those words are synonyms. So ml, cc doesn't really matter. They mean the same. And that ties in directly to the next line here. The calibrations are either milliliters or cubic centimeters. They're the same thing. And they emphasize it here at the bottom. So we saw this in class. We had 3 cc syringes in class, and that's a very classic one for the type of immunization. For most antibiotics, you'll see 5 cc syringes. Sometimes you might be out of a 3 cc, so you use the 5 cc. Try to avoid it, of course, because that's extra plastic that we're throwing away, and we want to control that amount of plastic. But if that's all you have, then that's what you'll use. So this is like a very common, just basic immunization type of syringe. Versus an insulin syringe. Now look at the gauges here, not the gauge, look at the quantity, the way it's metered here. These are designed especially for administering insulin injections. Calibration is in units, and that's what I was struggling with when I first switched to this slide. When we're talking about insulin, I was looking for the word. We want to calibrate them in units. So the little markings here on the side, I'll flip it back for a second, especially in the hypodermics, these are calibration marks that you see on the syringe. So it starts at nothing, then a half cc, then a full cc, then 1.5, all the way up to 3. So those are cc's or milliliters. When we're talking about insulin, though, we talk about units. And you'll find these syringes have a shorter, very high gauge needle. The calibration's in units, not in cc's, so a completely different measuring system. The U100 syringe is calibrated into 100 increments in units of 2, and these are the most common things you'll see for insulin administration. We also have a U50. The U100s are probably the most common that I've seen in my personal experience. There are now many creative devices that pharmaceutical companies have come up with in order to administer insulin. So in many cases, patients don't even use insulin syringes anymore. But you still want to know what they are, and you still should be familiar with their use. And then we have the tuberculin syringe. This has a total capacity of 1 milliliter. This is divided into tenths and hundredths of milliliters. So here's a third system. We have 3 ways to gauge and measure the amount of medication we're using. You know, we're either talking cc ml, or we're talking units, or we're talking divisions of a milliliter. And all 3 have their own application. Just so you know, a tuberculin syringe we're going to use to test for TB. So it's that common skin test we use called a PPD. And it's how we test for TB. I guess I've already said that. No, what I wanted to say, it's an intradermal injection. And just incidentally, in case you're wondering, PPD stands for Purified Protein Derivative. So we administer PPD in a tuberculin syringe via the intradermal route, and we have the patient come back and see us within 48 to 72 hours, and then we're looking to see if there's any swelling at that site. And you probably know that protocol, and I'm probably going a step further than I need to for this particular slide. We'll talk all about that as we move through the semester. All right, that covers all our syringes, the various gauges of needles that we can be working with, and the way that we measure doses on the different types of syringes. And these would be the 3 types of syringes we'll be working with this semester. I'm going to go ahead and pause it here, and I'll be back with you in just a few moments, and we'll start talking about the vaccine information statements.